My name is Wim Goettsch. I work for the Dutch National Healthcare Institute, also known in the Netherlands as Zorginstituut Nederland. We are responsible for advising our Ministry of Health on reimbursement of new health technologies like pharmaceuticals or medical devices. On the other hand, we are also responsible for quality of care of hospitals in the Netherlands, and we have our own health quality institute which advises, for instance, hospitals on quality indicators and health outcomes. Well, in different topics. For instance, we do a lot of work on appropriate use of new health technologies, like appropriate use of medicines, for instance. In order to actually work together with physicians, we need the data from hospitals to actually see how these drugs are being used and what their effects are on the outcomes of patients. That's one hand. On the other hand, also we like to support patients so that they can make the best choices if we want to go to hospitals. And that means that we need to have good quality of care indicators, and there we, for instance, help the hospitals to provide those. And for instance, to see actually which kind of patient-reported outcomes they need to use so that we have the best indication on how certain treatments affect the health of the patients. I've been contacted to Health IGD when we actually were involved in a project around data, an IMI project, and I learned that they do a lot of work on how this data can actually be extracted from hospitals. So we think that this extraction from data and how can you standardizedly organize that you get the same data, good quality data from hospitals, is very essential to actually get good evidence which you can use in decision making. So I think that the Institute is an important partner in actually getting those data available for instance, institutes like ours. I think there is no way of doing this by yourself. So if we want to have good health data, we have to be sure that, for instance, the health outcomes are relevant to patients. But we also have to be sure that that will help the physicians to make actually discussions with the patients on the treatments. But we also need to know whether these are the same health data which are being collected by manufacturers, for instance, if they do their clinical trials or their studies in real life. So in that sense, you have to actually develop a common framework which is acceptable to all stakeholders, and therefore this interaction with stakeholders is crucial. I think that you have to indicate that you want to do something which is helpful to quality of healthcare for patients, and that you want to actually ensure that there is some system which can be used across borders. I think that we still are very linked to our own national systems, and if we want to actually go to a Europe in which patients move around through countries, and you want to actually assess between countries what the quality of hospitals is, you need to have a kind of, well, more standardized system. And therefore a project like yours might help to actually have the same kind of standard indicators around Europe, so that actually we will be much more able to actually make these comparisons around Europe. I think if you talk about social benefits of health data, I think in the future, ideally, I would see also as a person, if I become a patient, that we have all our own patient portals, where we have our own data, all our data on what we did in healthcare. Maybe also linked to some personal data, which you could subsequently actually fill in through an app or to a watch or something like that. And then subsequently you as patient are responsible to say, well, you can use those data for this type of research. So ideally, I think the patient should be the one who makes the decision, or the person, citizen, where his personal health data are going to be used. And this is something which I would see would be the best future. Because now I'm sometimes a little bit worried that these patient data are in hospitals, and as a patient you have no clue how these are being used, who is going to be using them. So ideally, you would have like this personal health environment where you have your data, and subsequently you decide, well, this data can be used there and there and there. And then there should be the technology to support that.